Dr. Swadeep Srivastav from HEAL Foundation. HEAL Foundation, I'll just introduce in a couple of lines. We have been at the forefront of health education for the last almost 2 decades, 20 years. And we said this is the right place to start our program, where HEAL Foundation has come forward and initiated a coalition at the Asian level called Asian Coalition for Health Empowerment. And we are just on the formative stage, but as I told you, the core agenda of this coalition is of health empowerment, and we always wanted to start with the doctors and with the women. Very fruitful discussion around this topic of micro and macronutrient impact of smoking and heart health.
Please see how the smoking directly burns your heart. Fumes coming out, smoke coming out. So micro and macro nutrition have direct impact on the heart health. So today's discussion, I'll briefly summarize on these headers: role of smoking cessation and balanced nutrition, what cardiovascular disease is, and some of the most common myths which we should be enjoying to know, and the importance of knowing your targets for blood pressure and cholesterol, very commonly talked by all the patients to all the doctors, steps and strategies for managing risk through movement. Movement means mobility, exercise, smoking cessation, taking medication, and healthy eating. What are the warning signs and symptoms these days very commonly asked of the heart attack, stroke, and sudden cardiac death, and importance of setting realistic goals for which we are all assembled here. Now we have smoking preventive strategies. We have made low tar cigarettes. These are the strategies which are under consideration. And then we have modified cigarettes which have probably a different constituent, like a little bit of marijuana, but it's a very small concentration and they give us kick but not the harmful effect of nicotine. Then we have patches, you all know, nicotine patches, then gums, and then we have nasal sprays, and then lastly I found we have a visiting faculty from Israel, and he told two funny things. One was that one of the staff of a submarine, the case of staff of submarine, about 20 people who were on duty for more than 4 months, and as soon as submarine came, they came back from the duty, they came out, they were not smoking for more than 40 days, but as soon as they were at shore, each one of them started smoking. So it's from here that we have to prevent smoking by good thoughts, good counseling, and by quit cold turkey method.
So how is smoking related to the heart disease and stroke? These are the reasons. Smoking is a major cause of cardiovascular and causes one of the every fourth death of cardiovascular disease. So what does it cause? Raising triglyceride, which is bad cholesterol, lowering good cholesterol, which is HDL, making blood sticky or thick and more likely to clot, which can block blood flow to the heart and brain, which causes a stroke. Damaged cells that line the blood vessels, which causes atherosclerosis. Increase the blood buildup of plaque, which made up of fat, cholesterol, calcium and other products or substances in blood vessels. Seeds में आपका chia seeds, flax seeds, basil seeds, these are having more of the omega-3. Lean proteins such as fish and poultry, these are having less amount of cholesterol, although these are having good amount of the omega-3. Whole pulses should be taken because it is having good amount of fiber, which helps to cope up the problem with the cardiovascular disease, क्योंकि generally आपका high fiber ही diet में जाता है cardiovascular के साथ में. Decrease salt intake, it should be up to or lower than 6 gram per day. Unsaturated vegetable oil like olive, mustard, rice bran. Limit alcohol intake, that should be or lower than 14 units per week. And phytochemicals which are basically antioxidants, आपका ग्रीन टी हो गया, ओट्स हो गया, सीड्स वगैरह हो गए और हर्बल टीज़ हो गई. दीज आर दी एंटीऑक्सीडेंट जो आपका जो भी बॉडी में फ्री रेडिकल्स होते हैं उनको बॉडी से निकालने के लिए, क्योंकि वही आपकी जो सेल्स हैं उसको डैमेज करते हैं.
Today we have gathered as HEAL Foundation and Asian Coalition of Health Empowerment to continue with our objective of health education, and that's why today we are at Manav Rachna Dental College.
So this is an SDG goal which we are trying to sort out, and what is the outcome which we are looking at is de-addiction. At our times it was alcohol, at our times it was drugs. Now it's smartphone. The initiative of unhealthy behavior like smoking, drinking and drugs often begins during adolescence, and this poses a significant public health challenge, leading to social, physical, mental health problems that accumulate over a period of time.
Addiction matlab lat. Lat is considered as the biggest de-stressor in today's world. When we are tired of everything around us, our easiest escape is our lat. Every addiction, be it as small as scrolling Instagram reels for 2 hours at a stage or to eating tobacco for 2 long years, is wrong, because everything is too much gives too much trouble to our body.
Addiction means your brain is not able to remain under your control. When you get used to certain things, so the main part of the brain, which is the frontal lobe or the prefrontal cortex, that imbibes all these pleasure things. So when the prefrontal cortex starts liking certain thing and it goes into a mode that it gives a lot of pleasure to the body, to prevent this addiction of drugs or addiction of alcohol, addiction to smartphones, lot of strategies are being adopted by the international organizations. So international strategies has to be collaborative. If we develop certain policies, then it has to be used by everybody. So we have to come out with some useless propositions. So internationally, you can see the United Nations Office on Drug Crime, they are trying to do their best to make these drugs controller work, so the drugs are not easily available. Then the World Health Organization is doing its own bit. United Nations International Drug Control Programs are already underway. Global Commission of Drug Policy is also working. International Narcotic Control Board is monitoring implementation of the international drug control. So all these agencies are working in tandem, and that is the most important thing.
I would like to draw your attention to point number 2. Many people, but not all, start drinking alcohol or first engage in an activity voluntarily. However, addiction can take over and reduce self-control.
This is the topic for today. Achieving Sustainable Development Goal 3 need to focus on international strategies of de-addiction of drugs, tobacco, alcohol and smartphones. To start with ACHA, I would like to give a brief that what it is about. The Indian Medical Academy of Preventive Health has taken a proactive step to confront the harm caused by tobacco, alcohol, drugs and smartphone addiction. These addictions are a huge burden on society from decades. Smoking cessation programs are there which offers the counseling, nicotine replacement therapy and medications. Latest data shows the smoking cessation can reduce CVD, cardiovascular disease risk up to 50%. Alternative products like heat not burn, which sir has already explained. Heat not burn, it is not heating, it is heating, it is not burning, it produces less harm in our body. So those persons who are not able to stop just like that, they can switch on these treatment. Products have shown good result in smoking cessation. Recent studies suggested potential de-addiction benefits.
Smoking is such a hated thing in the society, but still people are not able to leave smoking. And this is one of the very easily modifiable risk factors. And the health effect of smoking, you all know that it increases the risk of cancer, heart disease, risk of respiratory diseases. COPD, as you know, is the third commonest cause of mortality all over the world. And very importantly, infertility and stroke, and also osteoporosis and increased risk of hip bone fracture. Smoking primarily causes coronary heart disease, leading to death all over the world, and especially after COVID, we have been seeing more cases of death related to COVID. Chronic cigarette smokers are almost 2 to 4 times more likely to develop heart disease. Nicotine replacement therapies. And then we have a set of things like gums, patches, micro tabs, nasal sprays, inhalators, and lozenges available. So those who sincerely want to reduce intake of tar and intake of 5,000 other toxic materials in a cigarette, they can take the help of this, but this should not be the ultimate goal. So, ultimate goal is to counsel yourself, get counseled by others, use some of these therapies, and make your cigarette packet dead. Now, I am not talking about this because this is not allowed in India, but this is a beneficial therapy. Vaping has been allowed in Great Britain and other countries, European countries, USA, and they have shown that incidence of deaths and lung cancers has been reduced by 30%.
By WHO, 269 people use drugs, around 113 people smoke tobacco, and around 2 billion people consume alcohol, and around 36 billion people use smartphones, of which an estimated 210 suffered from smartphone addiction. And in 2018, nearly 4 lakh people died in road accidents because of addicted to smartphones. So prevention of education campaigning plays a significant role in reducing addiction rate. Globally successful initiatives have effectively educated communities about the rise of addiction and encouraging healthier choices. Sweden, डॉक्टर साहब ने भी बताया 5% is only the reduction because people are aware. उन्हें पता है कि ये चीज़ ले रहे हैं हमारे स्वास्थ्य के लिए हानिकारक है, उसको उन्होंने छोड़ दिया, तिलांजलि दे दी, मुक्त हो गए उससे, इसलिए वो बीमारी से भी मुक्त है। और आज 5% अगर वहाँ है तो ये सराहनीय काम है। Addressing addiction to drugs, tobacco, alcohol and smartphones integral to achieving डेवलपमेंट, सस्टेनेबल डेवलपमेंट गोल का मतलब ही है कि हम स्वास्थ्य के लिए लोगों को स्वस्थ रखें।